Welcome to Kingston, my fellow peers, ladies and gentlemen, children and young adults. I want to thank you, Kingston Prisoner Justice, and the rest of the people that have organized this today and allowed me to speak on behalf of my son. I would also like to thank Yusuf and the Justice for Solomon team because they have been my strength. They've helped encourage me. Your team is amazing, and I also wanted to take a few moments to thank my husband because he is my strength. And he's done so much for me in the last 2 months that I can't even imagine. Today is my birthday, and he sacrificed everything he wanted to do to be here to speak about my son. And with that, I'd like to read a little poem because it kind of really touched my heart and really put in perspective what I'm kind of going through as Jordan's mom. When my son was most challenged by the substance use systems and behaviors, I had to make a conscious choice, a practiced courage, and maintain my dignity with my neighborhood, my community, my healthcare system. At the time, I did not realize just how much I was silenced by society, by stigma. I felt isolated, judged, overwhelmed, and I still feel powerless. I'm here to talk to you about my son, Jordan. But first I want to change the reflection to a different time, in a different place. I want you to imagine that Jordan was in a hospital instead of a prison. I want you to think about healthcare nurses, PSWs, social workers. If Jordan was acting strange, as they claim that he was the day that he died, they would not have thrown him in a bedroom or locked him behind bars. They would have provided him support that he needed, but he didn't receive. If that happened with those doctors, nurses, and PSWs, they would be in jail. It would be called neglect. And I want to know what the difference is between these jail guards that are killing our people and nurses and doctors not doing their jobs. I really would like to know what stands them above our law. Are these guards allowed to choose life? Because I thought assisted deaths required an application and a full medical review. We sent my son to Markham Stouffville Hospital because he was suicidal. The hospital was aware that Jordan was on house arrest, but he was innocent, waiting to be proven in court. We said he was not safe with us and he would be left alone for most every day. We were trying to keep our son safe, and we still tried to put faith in you that you could not provide us our security. No compassion was shown to Jordan being ill, and we asked him to cooperate, and he was irrational and out of control. That's why they call it a mental crisis, because they are irrational and out of control. So we put my son in jail for his safety. We explained to the doctor, Tang, it was a lethal type of drugs, heroin laced with fentanyl, and we were honest, swallowed our pride to tell him where it might be. Did this not cause concern in your medical facility? A golf ball size amount of lethal drugs, heroin, laced with fentanyl? Patient confidentiality is only provided until the client is risking harm to themselves or someone else. What if we picked up Jordan that day and those drugs killed your son? Would it be a concern then? What if Jordan gave it to someone who was suicidal on your mental ward? Jordan had a brain of a 12-year-old. Would that have been a concern then? No intervention was used, no suicide watch, no screening, and no checks. Jordan was irrational and told me he didn't want to live. I never heard him so tired of this world, but he still said, "I love you, right, Mom? Love you, Mums," he always said. Transferred to Markham Stouffville Police District number 5 for the night in a holding cell. Is this how we treat someone having a mental health crisis? Saturday morning, transferred to Central East Correctional Facility. No checks, no screening. Was our information not carried on by Dr. Tang? We swallowed, so big on our pride when we told you where to look. No suicide watch, no intervention. Jordan overdosed that very day. He was treated with Narcan and sent back to the hospital for a check. No screening again, no suicide watch, no 48-hour watch as per their policy. He started acting weird. Why was a nurse not called? Why was he not transferred back to the hospital? Jordan is a man that suffers seizures, had a brain injury, and is in a mental health crisis, and just had an overdose in the Lindsay facility. You said you were aware of his health problems, but you tossed him in a cell. When you found him barely clinging to his life, they ignored protocol and did not give Narcan. They knew that there would be no chance to save him with just CPR, for fentanyl shuts down your respiratory system, and without Narcan, there's nothing you can do. They aided him to die. That was a choice made by those guards, not a healthcare professional, with no application and no review. It's neglect. It's involuntary manslaughter. It's negligence manslaughter. It's corporate manslaughter. They have yet to answer for anything they've done.
Shame.
Jordan is dead. My son, my sweet loving boy, he's my friend. I can't bring him back, but I can advocate and save lives and bring education awareness, because no mother or father or family should ever experience this type of complete, traumatic, uncontrollable, unconsolable grief and pain. There's no justice. There's no peace. Make this opioid crisis a national emergency. Justice for mental health. Justice for Jordan Sheard. Justice for Solomon Farik, and justice for Shane Spalding. Justice for Adaman Hasten, and justice for Steen Duffy. There are so many names, but I just want to say justice to all those lives that were lost, to the injustice of our justice system that has failed us. Thank you.